Hi everyone, I'm Dr. Shimi Kang. The COVID-19 pandemic has been so difficult for everyone, but possibly most difficult for children. Their lives have changed so much. It's hard for them to understand and they're scared. So I hope that you find this question and answer period I did on CBC News helpful. It is specifically addressing issues for children and how to deal and cope with the COVID-19 pandemic.
And right now, let's get to the live Q&A session where we're going to take your COVID-19 questions to the experts. Today, we're focusing on, as we say, your children, how they're handling the onslaught of COVID-19 information, or how you can help them prepare for a virtual education system, which may well be the direction we're going. And of course, the anxiety and stress that might accompany everything that's going on. You can ask us questions over email. All the information's on your screen there. You can give us a phone call, as some of you are already doing, or contact us online on Facebook, YouTube, or Twitter. We'll try to get to as many questions as we can in the next 10, 15 minutes or so. So as promised, joining us once again is Dr. Shimi Kang. She is a psychiatrist and author of The Dolphin Parent, a guide to raising healthy, happy, and self-motivated kids. Dr. Kang, thanks for joining us again. We appreciate it.
Thank you for having me.
All right, let's get right to the questions. I know we spoke to you last week about anxiety in kids during this time, but a week has gone by. What more do we need to know as the novelty of staying home kind of wears off on this, the day that the kids were supposed to be going back to school?
Yes, it really is a moving target. This is a really important week, as we just heard, from a public health perspective. So I think kids are getting tired, parents are getting tired, but this is a very important week to replay all of the messages from before. Kids need repetition. They need to hear the same thing over again, likely in different ways. And then also give them something to look forward to. So for the public school kids, that school is going to be starting. I know some private schools have already started some activities, getting them to prepare mentally for this idea that they will be back to class and learning as well.
Okay, well, let's talk about preparing for what may well be an online learning situation. Give us some advice there. Does there need to be a set schedule? Perhaps that'll be dictated by the schools, but is a set schedule something that would work better, something that mimics the actual school hours?
Yeah, so everyone's going to have to be creative and flexible in this case. And first, just want to recognize that, you know, the online experience is something that needs to be accessible to every child in the province. So, you know, I think reaching out to anyone who may not have a laptop or phone, if you have an extra one, we really want every child to have the ability to have an education. And I think that is a barrier right now. But having a flexible but firm schedule is really important. So I would encourage parents to sit with your child. It doesn't have to be exactly the same because you're not commuting or driving, but find a time for waking up, brushing your teeth, getting kind of hygiene issues out of the way, breakfast, and then once the school schedules are in, some schools are doing what's called staggered. So every hour it's going to be a different age group. Some are doing all school assemblies. So I think we have to wait and see what each individual school has planned. But you can start talking to your child about that routine. There will be lots of free time or unstructured time for reading, and don't forget recess, meaning that you want your kids to be outside in the sun, in the backyard, or you know, going for their walk. So and then create your evening schedule, so dinner time, bedtime, bath time. So starting to build in a routine is going to be really important this week.
Maybe even homework as well. All right, here's a couple of other questions. How do you socialize kids in a safe way during this time of self-monitoring, physical distancing?
Right. So the easiest way, and if one of the things that I'm realizing with a family with 3 kids, a husband and my mom-in-law are all here, is we need to sort out a way to socialize together with everyone in the home, but also find that balance of having your own time and alone time. And then really reaching out to your community. So your friends, your grandparents, your uncles, aunts, people that you want to see and connect with. I think that's really important to start making those efforts to do that, scheduling in those phone calls, ideally through video chat or Zoom or Skype or FaceTime or URL Live or any kind of platform. Like kids do need to see each other's faces. They need to look in each other's eyes, hear voices. So having that is really important. There are a lot of online programs. Our program, Dolphin Kids, is running free interactive live classes all day long for kids of all different ages. And these are run by kids helping kids, doing crafts, coding, math, all kinds of different activities. Those are really great opportunities to communicate, talk, share ideas. So look for those opportunities. They are out there, and many are free.
All right, very good. Next one. How can parents answer questions about COVID-19 in a way that the kids are going to understand it?
Yeah, so this is so important. It's a frequent question I get asked. I always say there's 3 aspects to our communication with children. Number 1, we want to tell them the truth. They know what's going on. They can hear conversations and watch the news. So be truthful in an age-appropriate language. Number 2, be optimistic. So in your conversations with your child, find the positive, find the numbers of people who are recovering, find that 42% that you just mentioned earlier that have fully recovered, find the efforts of the healthcare system and how we are ready and working hard below capacity. So find those areas that are really clear, truthful, and optimistic. And then thirdly, give them an action item, give them something to do to feel empowered. So whether it is, washing their hands or wiping down counters, or calling their grandparents, or doing anything where they are feeling active and empowered, where they have a choice and decision-making in their hands, that's going to be very helpful.
And you mentioned, of course, first and foremost, telling them the truth, but still some are going to be very scared. How do you try to, as a parent, make it less scary for them?
Right. So a lot of times giving them analogies or metaphors, things that they're familiar with. So many kids have had a flu or a cold. You can use that. You can say, this is similar, but different. So just like with the flu, you can get it from touching people, from people coughing. Just like the flu, most people recover and are just fine. It's not more than a few days, but some people can get really sick just like that. So try to use those analogies. If there's something else in their life that they can connect with, definitely use that. So for younger kids, I recommend play. So drawing pictures, using their stuffies or Play-Doh, all of those ways of enacting what you're trying to communicate can be very helpful. Play is the language of young children. Teenagers, I think you want to start asking them questions, be less instructional and more open-ended and curious about what they know, what they're thinking. Try to get them to talk by asking open, curious questions to them.
Yeah, and at the same time, it can be, it is a very stressful time for a lot of parents. And here's a question about that. How do you try to stop passing along that anxiety to your children?
Yeah, that's such a good question, because there's not just anxiety about health and social distancing, but many parents are worried about their job, how to pay the rent, how to get groceries. So yes, and all of that can easily be transferred onto the child, who is now worried about their home and their security and food and shelter. So really be mindful. It's all of the common sense things we know, but we have to be more intentional and deliberate. So if you're having conversations about finances or loved ones' health or those concerns, really try to do them in a private setting. This is more important now than ever before. I know it's hard. I slip up all the time. If you do slip up, then just check in with your child and say, hey, did you hear what I was talking about on the phone, or, with your dad or whatever? and then ask how they felt about the conversation. And then again, reassure their fears, focus on whatever optimism, positivity you can find. Yes, I'm not making as much money as I used to. Our business is going to be hit. However, there are government subsidies coming. We have this solution. We have this idea. So that's really important to always give the solution.
All right, here's another one. Any suggestions on how parents can find a moment for themselves away from the kids while having to care for them pretty much all the time?
Right. Yeah, this is such a challenging time for parents in general. Now it's even more. I think, we have to go back to all of those age-old, it takes a village to raise a child, even though we are not able to socialize and physically connect like a village. Try to create your virtual village or your internal village if you can. So if you have older children, give them some responsibility to look after each other, to babysit each other, to read stories. If there's a grandparent that's isolated, schedule a story time, a FaceTime, so that you can go take a shower or, have a meal. So really use your community, use your pod, use your village. It's time to be creative. And it's okay to ask for that help. All parents are feeling it. So, have a neighbor or a friend and say, look, can you call my kids at this time because I need to do this and I'll do the same for you. So really kind of tap into your resources.
All right. A lot of us have limits on screen time, the amount of time our kids can spend on the iPad or the Xbox or PlayStation, what have you. Should we be, in some cases, maybe relaxing those rules a little bit as we go through this pandemic?
Yeah, so that's a great question. I have 3 kids. I have 2 teenage boys and a 9-year-old, and screen time is going through the roof for everybody. The best way to think about it is I talk about the technology we consume impacts our mind, very similar to the food we consume impacts our body. No one's going to agree that right now is a great time to be consuming a whole bunch of junk food. We understand that we need to have a healthy diet to stay healthy. And yes, a little bit more comfort food, that bag of chips in this time of stress can be forgiven. So what we want to do with technology is recognize what is the junk tech, that technology that really isn't bringing in a benefit. So I often say things like mindless scrolling. You're not really doing much. Certain video games that are just, the child is like zoning out. There's not a lot happening there. And there's specifically healthy tech. And healthy tech is anything that allows you to create, connect, and care. Meaning if your child is creating things on technology, they're building websites, they're drawing, they're making music, that's good. If they're connecting in meaningful ways, calling people, calling friends, talking to people face to face, that's great. And if they're caring, if they're doing any kind of self-care, so looking at their step, fitness, mindfulness apps, anything like that. So care, create, and connect, that's healthy tech. Limit and monitor the rest, just like you would junk food right now.
Okay, we've got time for one more very quickly. This is right up your alley. What this person asks are the most common ways that kids are affected in times like this?
Well, children are very resilient. Humans are very resilient. I think that we have to really recognize the diversity of how all of us are going to be affected. But there's ways to mitigate any negative impact. The ways to do that is to give them that truth, focus on the optimism, give them action. One of the superfoods for a time like this is contribution. Having your child connect and contribute in meaningful ways. There's a program right now called Kids Helping Kids across the globe. It's children as young as like 9 who are going online and doing lessons and crafts and coding and all kinds of stuff for kids across the world. They're making posters for Italy, and posting them. So having your child get involved is an anecdote. It helps mitigate any kind of negative impact. It makes them feel good about themselves. So I would really try to focus on that to minimize the downsides of this time.
All right, Dr. Kang, we'll leave it there. Thanks so much for joining us again this afternoon. We really appreciate it.
Thank you.
All right, Dr. Shimi Kang, a psychiatrist and clinical assistant professor at the University of British Columbia.
Thank you for watching. I hope you got some good solutions for your family to help get through the COVID-19 pandemic. Stay tuned for more episodes. I will be covering a lot more topics related to COVID and, of course, your general mental wealth. Don't forget to subscribe.